Hello, my name is Blondine Cineus. I am a CNA at Meadowbrook Care Center in Freeport, New York. Today we are going to meet with Laura Gillen.
Blondine, thank you so much for meeting with me today. I really appreciate you taking the time to just talk with me a little bit about your job. What is it that you love the most about working here?
To be able to come and give the resident a sense of well-being, that they matter. And then they're happy to see me come in. Even if I had a bad day, that made me feel like come get up in my bed. If I'm in pain, I just want to come to take care of them.
So what would you say are the biggest challenges that you face at work on a day-to-day basis?
The number one challenge is when you don't have enough staffing to care for the resident. And most of the residents, they take time. We need more staffing because that's the only way you can give the quality care.
As someone who had a loved one and a family member here, I know how important it was to my family that you had that time to take care of my father and to be with him. And certainly, I think every family who sends a loved one here would want the same thing for their loved one. So, Blondine, you told me you've been here since 1996, or how things have changed at Meadowbrook.
The residents, they're older, and most of them, they have the healthcare insurance, but they have to pay a lot of amount of co-payment. So they're not even able, they don't even want to go to the doctor, to the hospital, and they take it too late, and then by the time they go to the hospital, they find a lot of things wrong with them. That's why they end up here.
So people are delaying treatment, and it's causing more negative outcomes.
But if they were able to afford to go to the doctor, that would really help.
So, you know, there's a lot of talk about Republicans wanting to repeal the Affordable Care Act, which is frightening because so many people can only have insurance because of the Affordable Care Act. So in Congress, it will be my priority not only to protect it and to make sure that it is not repealed, but to enhance it. We need to do everything we can as elected officials to make sure that we are making health care truly affordable for all Americans and not just for the wealthiest Americans. I know this is one of the most expensive places in the entire country to live. Maybe you could describe the challenges you're facing in terms of cost of living.
At home, I have my daughter living with me and 2 grandchildren, because she was married and living in an apartment where she wasn't even able to afford. She was living in a studio for almost $2,000 per month with 2 kids. They end up living with me, and my daughter went back to school, so I have to provide for them. But when you go to the grocery store, a gallon of milk is a lot of money, and that's what kids live on.
I understand. I have 4 children, and my son just came home from college, and I think I go to the grocery store 3 times a week just to keep him fed. They've been taking advantage of their consumers for a long time with price gouging. Sure. So this is something that should be addressed at the federal level, and it's something that I intend to tackle in Congress. We need to get back on the right track and have an economy that doesn't only favor the richest people. I want to go to Congress to start fixing problems and to making people's lives better. Because like you said what you love about your job is you make a difference in people's lives. Yeah. And that's what I wanted.
And you will be doing it. It was great to meet Laura Gillen. She can fight for the one that's in need. She has a good heart, and she's not thinking about herself. She's thinking about other people.